Are we ready, Greg?
Yes.
Yep. Okay. When people come on, you moved on my screen, so I was like, where did he go? Okay. Welcome to Board of Health for the month of June. Let's go ahead and I'm going to go ahead and call us to order and get started. Frank, I do not believe we have anybody for privilege of the floor this morning. Is that correct?
That's correct.
Okay, great. So let's start with approval of our May minutes. Those are included in your packet. So if I can get a motion for approval as written from David and a second from Melissa. Any discussion by Ed? We're on the minutes, Ed. Okay, all in favor as written? Hands up. Okay, and Ravinder, do you want to verbally give
Ravinder in favor.
Okay, in favor, and I think that's unanimous. So no opposed, right? I got everybody. Okay, great. All right, let's go ahead and move on to Brenda and the financial summary.
The financial summary for May is in your packet. I really don't have anything to add to the written report. We are continuing to juggle our various COVID grants and are starting to get some of our ongoing grants approved by the state. You'll notice the Healthy Neighborhoods grant was approved through March of 2021, although we've not heard on the one that would start April 2021 to 2022. WIC, we've submitted. It is a flat funded contract for the second year in a row, and we expect a new 5-year RFA to come out potentially any time now for the next year. So I don't have anything to add.
Okay, great. Thanks, Brenda. Any questions for Brenda? So I had a question that might cross over Brenda and then Frank, who's about to come up next. Is the money that's flowing into the county for, I can't remember, that we're getting for, I don't think it's COVID relief, but I can't remember what it's called, that's coming to the county/city. Is any of that coming to public health, or is there any discussion about that?
Yeah, the legislature is going through that process right now. There's a public survey that's out for anyone in the community that wants to offer suggestions, or I think it's a prioritization effort of some predefined areas. And also department heads have been asked for thoughts or plans for the funding. We have until, I think, Friday. We had like a week to turn some things around. So we're looking at some ideas. One of the bigger challenges is that we're in the middle of budget season too. So we're planning this year, you'll see when our budget comes to you, we're going to have significant OTRs at the health department, more than we've had in a long time, just because we need to make sure that our hat is in the ring for funding as it's being considered. So we have quite a bit there, upwards of over $500,000 in OTRs. We're still putting the final touches on that, and you'll see those, I think, next month. We'll have those to share with you. So we're looking at it there, and we're going to put some ideas together for the county by Friday. I think I don't really understand the process that they're going through at this point with it, so I think we're going to have to just follow it closely and weigh in on issues that we think need to be brought to their attention. And Sam just put in the chat the survey, so if anyone is interested in taking that, please do.
Great, thanks, Frank. And just because we have some new board members, could you explain what OTR means?
Sure, yeah, sorry about that. Yeah, so the county budget process, we are given a target dollar amount of county funding we use to complete our budget with. And for any county funding that we want to request above that target, it's called an over target request, or OTR. So much of the budget process for the county centers around the funding or not of those OTRs that are submitted by county departments.
Great, thank you. Okay, any questions for Brenda or Frank on that topic? Okay, Frank, I'll have you go ahead with your administrative report then.
Great, thanks, Christina. Just a couple of things. We're moving along with vaccination efforts. The team is actually up at the Trumansburg Fairgrounds doing a Johnson & Johnson clinic right now. We have a couple of second dose for the kids at New Routes and Trumansburg this week. Next week, we're doing some smaller pop-ups in Enfield and Caroline for J&J. And we're also trying to schedule some of those the business and organizations that submitted, filled out the form online that they had 10 or more people and were interested in hosting. So we've got a handful of those left after REACH and the hospital have done some. So we're trying to get the vaccine out to people. We've also been redistributing vaccine through the hospital to a lot of providers, healthcare providers in the community. So that's beginning to happen, and vaccine is readily available at local pharmacies as well. So we're doing well and continuing to get folks vaccinated. We're actually doing pretty good with getting the supply of vaccine redistributed as well. As you know, we had thousands of all three types of vaccine, and so we've essentially become the regional vaccine redistributor. And so Mike Judd, the pharmacist at the hospital, has been doing a great job of keeping track of all of that and getting the vaccine distributed out. So I believe we're under 1,000 doses of J&J and Pfizer at this point. We still have thousands of Moderna because it's not as popular these days. But generally speaking, we're doing the best we can to get the vaccine distributed. There was an extension of the J&J expiration date from, I think it was June 23rd, tomorrow, till August. It was 45 days, so you guys do the math, I guess the end of August. So that was really good news because it really allowed us to do some more of those pop-ups with that vaccine that we had. So good news on the vaccine front. Disease numbers remain low. The folks in CHS are still doing all of the isolation and quarantine, but you've probably seen there's been single to zero dose days, and we're in single digits for actual current cases. So that's all good news. And I think that's about it on the COVID front. I am starting to transition back. I'm at Mental Health Today, back into some of the regular non-COVID work. I will be taking a few days off. I'm off this Friday through Tuesday. And then beginning July 23rd, I'll be off for 3 weeks through August 15th. So my plan is to kind of have that be a bit of a break for me, but also a transition point to getting more focused back into the regular day-to-day work when I return mid-August, assuming everything continues on the same trajectory with COVID. So I think that's all I have. Christine, I'm happy to answer any questions.
Great, thanks, Frank. I'm glad to hear you're taking some vacation too. Any questions for Frank? Okay, let's go ahead and move on to health promotion. So Sam.
Hi, everyone, I don't have any updates right now. Thank you.
Okay. Any questions for Sam on her report? Alrighty, let's go on to, is Dr. Claypack on? I don't think I saw him.
No, he was unable to attend today.
Okay. So were there any specific questions on his report that need to get passed along, or we're good to keep moving? Okay.
Oh,
okay, great. Claire for Division of Community Health.
Hello. So May was a very busy month. The team really adapted to kind of take lead on clinics and schools and continued the other clinics in homebound and rural. And we did see there was an uptick in early May of cases compared to April. So it was really a busy month for our team. And we were also down 3 nurses, 2 vacancy positions that we're still recruiting actively for, and one of our nurses who is out returning in September. So I think, as Frank said, the cases are winding down, which is really encouraging. And we're also adjusting the team, sort of trying to, we've got a lot of departures in May, planned departures. And I think we're kind of settled now in our trying to right size ourselves for any projected upticks that we might expect in the fall. We hope not. We hope that this trend continues, but we want to be prepared in the event that that it does. We are starting up the maternal child health program activities next month, towards the end of the month, and hoping to start up with our vaccine clinics in September, possibly earlier as needed. Rabies has been very busy, and I think, you know, we're adjusting to a lot of changes with getting back to the normal routine, and still recognizing, you know, there were a lot of changes in the team composition and lost a lot of great team members to retirement last year. So I think the team is doing an incredible job adjusting to those changes and supporting each other through this period. And we're also very happy to be planning to celebrate some of the efforts and recognize the efforts of the team over the past year with the health department next month. So thank you. That's all. No other additions.
Thanks, Claire. And it's great to also hear just from you the transition back, or hopeful transition back to a more balanced approach to the different public health topics that really do need to be covered. And I'm also glad to hear that there's some recognition activities going on. So if you need any help or support from the board on that, can someone just reach out to me and let me know, and we'll be happy to you know, support where we can on that. Okay. All right. I don't see, oh, sorry. Any questions for Claire?
Christina, if I could add a couple of COVID things that I'm sorry that I forgot. Claire triggered for me, and I forget it's a month between when we talk. The mall site for vaccination has stopped. They've closed down vaccinations there. June 12th was their last clinic there at the mall. So that amazing operation has now, completed its mission. The hospital's there and stands ready if we need to ramp back up again, but for now they are closed. They're also going to be transitioning the downtown location for testing on Tioga Street is going to be closing as well. So that's happening, I believe, over the July 4th weekend or around there. Testing will still be available at the mall, but only Monday through Friday as well. So there'll be some transitioning for them as well. And then a couple of bits of financial news that I forgot to mention. We did receive an additional, I think it's $330,000 from the state to supplement the funding that we received for the travel nurses that we've been using to help with case investigations. So that's good news. It's COVID money. It has to be spent on COVID activities, and so we're working through how we're going to align those funds. Much of it will be earmarked for supporting CHS in the event that we do have cases come up, have numbers go up in the fall. And then the other bit of financial news is the state, through the federal government, is giving us $2.6 million for school testing. Yeah, so it would have been a lot more useful a year ago, but they are providing that funding. We are partnering with BOCES and the local school districts to put a plan in place to accept those funds, and then we'll likely be subcontracting the funds to BOCES, and then BOCES will subcontract further out to the different school districts or private schools if they so choose to do testing. We've got three components of that program. One is for symptomatic testing, which would create PCR testing on site at the districts to be able to get rapid results from CMC if for symptomatic children. The other piece is for surveillance testing using antigen testing. So there's a component and resources set aside for that. And then the third piece is building a telemedicine capacity that we're going to pilot with ICSD, which would allow us to buy telemedicine equipment that could live in the school buildings and pay for some staff to be able to facilitate the use of that equipment to connect students with healthcare providers right there at school. We're using it, we're building it in order to use it for determination on whether additional COVID testing is necessary. But our hope is that it helps us build an infrastructure that would allow for some telemedicine resources to be within our local school districts moving forward. So just wanted you to be aware of that. Our plan is due Friday. It's due Monday. So we've got a draft plan and budget, and it's all getting worked up for submittal to the state for their approval. We don't yet know if testing is going to be required in the fall in schools, so it makes it kind of hard to plan. And many of our districts have said that if it's not required, they're not going to do it. So we're putting this plan together, understanding that we'll likely need to have to adjust it as guidance evolves on it. But just wanted you to know about those two funding sources that are coming to the county.
Great, thanks, Frank. And with is the testing of kids going to focus on the unvaccinated and symptomatic, or you haven't gotten that far?
Yeah, based on what we know right now, symptomatic children would get tested immediately, and the surveillance testing likely would be targeted for unvaccinated children.
Okay.
But we just don't know what the guidance is going to be for the fall yet. But that's our working plan. We've budgeted very high in those categories because it's a lot of money, first of all. So we've kind of put big chunks aside that we should have more than enough, even if it does end up being all students vaccinated or not.
Okay. Okay, thanks. All right, any questions for Frank on the additional follow-up, or Claire? Yeah, Ed.
With the changes that have gone on with the vaccine clinics and also the testing areas, is all this information posted on the website so people in the community have easy access to finding these things?
Yeah, I'm pretty sure our website is up to date with that information. CMC has been doing some outreach about the change in their operations that we then post and share as well. So we're trying to get the word out. The truth is, testing numbers have dropped off pretty dramatically, exponentially from week to week. So the numbers of people getting tested is much smaller, but we want them to know where they have access if they do need it.
Great, thanks.
Okay, great. Any other questions? All right, I'm not seeing, Deb is not here, right? Frank, I'm
No.
not. Okay, so, and is there anything additional that needs from her that we need to, okay.
No.
And so Jonathan was here, but he's gone off screen. So Jonathan, did you have anything that you wanted to add?
No, I'm here. No, I don't have a report, but I'm here.
Okay, great. And so Liz, it looks like we're to you.
I don't have anything to add to my report.
Okay, this is good. This is a quick meeting. All right, so it looks like the CSB report, Frank, is that coming from you or from Harmony? I'm not sure.
Yeah, Harmony can jump in. Much of what we talked about at the last Community Services Board meeting was the priority plan. So you'll recall that on the mental health side of things, we have an annual priority plan that has to be submitted to the state. Harmony did a really great job of working with the subcommittees and our community partners to really put together, a strong plan to submit this year. Harmony, we should share that with the Board of Health so they can see what ended up in that report. And I don't know if you had anything you wanted to add about that.
I would just say that some of the areas that we're going to be focusing on are really around issues with children's mental health services, specifically following the pandemic was one of the areas, really advocating for more of our substance use programs
that are in the process of being developed to get finalized, looking at crisis services like a continuum of crisis service support. Those were some of the bigger items that we have in the plan, but we can certainly give you a copy of it so you can see what each subcommittee is going to be focused on in the new year.
Great, thanks, Harmony. And Frank, any questions for either of them on this? Okay. So it looks like the last thing we have in terms of new business is just an administrative action. And so Frank, just remind me and Liz, is this just a straight up and down vote, or you're just letting us know?
No, it is a policy adoption, so it will
Okay.
require a vote.
Okay. So how do you want to proceed on this? What do you think is best? So, to have Liz talk about it a little bit and then put it under motion? Okay, go ahead.
Yeah,
Liz. Okay.
So the board has approved different policies in the past regarding our inspections, and both with kind of the increases in workload that we have, new priorities or mandates by the state, plus other concerns from the community or other areas that we need to be involved in. We are struggling. We will not be able to continue to do the same level of inspections that we used to at all facilities. And so we would like to have the flexibility to, we will do the minimum number that is required by the state before we would go beyond that. And so we are asking for approval of the policy so that we have that flexibility to, when needed, to drop down to the minimum number that the state requires. And in my cover letter, I identified some of the minimum numbers to sort of give you an idea of what it is. That can change depending on either regulations or guidance that the state issues.
Okay, so with that as an introduction, Frank, am I putting this under a motion? Like, in a second? Okay, I just wasn't sure if it was just yes, no, or whatever. So let's do a motion to approve as written. Can I get a first on that? I got a first from Ed and a second from David. Okay, any discussion or questions for Liz? Ed?
Yeah, I guess I'm just curious, how much of a departure is this from the frequency that we've been currently or doing in the past couple of years, as opposed to the COVID year? But it's, I guess I'm curious about the just the difference that we'll be seeing potentially here. I see you did say at least annually is what would be kind of ideal, but were we even doing ideal up until a couple of years ago?
So it depends on the program area. Quite a while ago, I think the board, right before I came, the board adopted a policy that allowed less frequent inspections than annual at mobile home parks. So we've been doing that for a number of years, where it's based on whether they have any, a poor operating history, if we have complaints, how the previous inspection was, whether we take enforcement action or whether they have a new owner. You also, I can't remember when it was, but you also approved a reduction in our public water supply sanitary survey or inspection frequencies a couple of years ago, maybe 5 or so. So mobile home parks, we won't be changing it any more than what we are. And this is just for what we are expecting for this year. Some of it is sort of unknown at this time. It is going to depend on sort of what hits us. We are struggling with our water supply program right now. So some of those inspection frequencies may back off. That would probably be for the surface water systems. Right, we are inspecting those annually, and I do not think the surface water systems need to be inspected annually, and they typically have, these are the big systems that have good operators, and we don't typically have major problems with them, and we're in ongoing communications with them throughout the year anyway. If we get crunched for time, temporary residences, hotels and motels are another area where we may back off on inspections. In previous years, we have done this. I can't remember when it was, but the code allows us to use other inspection reports. So we coordinate with code officers and fire inspections for the hotels and motels, and then may not do ours. So children's camps, we're pretty much, getting through the pre-ops now. And I expect we'll be doing inspections for those, but we are evaluating our workload kind of on a week-to-week basis with what is coming in, because there are a number of things that are changing at this time.
Okay, thanks, Liz. Ed, any follow-up questions on that, or?
I have a question.
Yeah, David?
So Liz, is this related to other COVID-related activities that your department has taken over, or is this because of reduction in staff?
So it is not related to our COVID-related work. Some of it, it's not related to our COVID-related work. However, in the COVID year's budget, we ended up having some staff cut, and then some was reinstated. So I forget exactly where that ended up, but we had wanted to request an increase at that year, and we did not, because nobody could. You were going the other way. So so it does reflect that we have needed more staff. It's not necessarily COVID related work. Our involvement, the community has become, it seems like there are more issues that are in environmental health is connected to that are take a lot of time and energy. There's a lot of discussion about watershed rules and regulations. Right now, there's this thing called a TMDL, a total maximum daily load for Cayuga Lake, that is proposed. And these things are quite involved and take a lot of resources. The state has also issued new water supply regulations, which is part of the reasons that's hard for us to do inspections, is they had the PFOA, PFAS 1,4-dioxin regulations that took effect last year, and the lead and copper revisions are coming online. They've just added various programs for cooling towers. Wasn't that long ago that they added that. The whole vaping thing has expanded our involvement with tobacco retailers. So it's a variety of things, community involvement, and then these primarily state mandates that come out, new regulations and things like that.
And we will be requesting additional resources in the budget that will be part of the OTRs that we're putting forward this year, because of all the reasons Liz just listed out. But in the absence of that right now, we don't want to be out of compliance with the board policy on our inspection frequency. And so this is really just setting it at the minimum required by the state, and which we will of course be in compliance with. Once we get through the budget process and Liz has a chance to kind of catch her breath post-COVID and potentially add additional staff, we can bring back to you what our expectations are for frequency of inspections at the different types of facilities. So that way you guys are, that way you are clear on what it is we're trying to do from a frequency perspective.
That will change annually, though. I mean, we can come back with what we will be doing this year, is just to clarify.
Okay, other questions, comments? Okay, so are we ready to put it to a vote? It looks like if we've got no additional questions or comments, all in favor as written. Go ahead and raise your hand so we can see. And then Ravinder, I'm going to have to ask you to come off mute and give us a vote one way or the other.
Yep, Ravinder says approve.
Okay. And I think that's unanimous. Did I miss anybody? So I think you've got unanimous approval. Okay.
Thank you.
All right. Yep. So that's it for all stated business on the agenda. Is there any other new business or anything that wasn't on here, Frank, or others that needs to be discussed?
No, I think we're good.
Okay. And Frank, just for clarity, can you remind us, do we meet in July and August, or we don't meet in July if you're on vacation?
Well, I won't be meeting in July.
Okay.
You guys are scheduled to. We do need to bring budget information to you.
Okay, that's fine.
So you have to do one or the other. I don't know that you have to do both. I can't remember if we normally didn't do July or normally didn't do August. Do you remember, Brenda?
I don't remember.
Or do we normally do both? And I just misremember. I know that we combine November and December, but then I thought we did something in the summer too, but I can't remember.
My calendar
Calling that.
says July and August. So.
Okay. And so maybe just because July can tend to be, and I know there's a lot of us that haven't had vacation in a long time and are probably taking vacation. So just to make sure, since they have budget stuff that needs to get done, if anybody knows they're not going to be here in July, Brenda, is that when you're planning to bring budget stuff to us?
So the budget actually is due to the county next Friday, July 2nd.
Okay.
I can submit a written summary of that as FYI to all of you.
Okay.
Frank, we can hold it till August. It kind of falls out of sequence with board meetings. So.
Yeah.
Yeah, no, I think I'd rather you guys. There's a lot of stuff that we're going to be putting forward that while it's financially based, it will affect policy, and that if we don't have the resources, we won't be able to do it. And I think you guys would want to hear about that. So if we can do a July meeting, I think it would be worth doing.
Okay, that's great. And I guess what I would just ask, if there's people who know now that they can't make that July meeting, if we could let Karen know, so that we're not kind of last minute realizing that we don't have enough people to have a meeting. Okay. All right. Anything else from the board or health department staff?
Christina, I did want to mention that we have a new position posted for a public health communications coordinator that we're going to be hoping to fill to build out the health promotion team. So I just want to mention that.
Can you send me a copy of that job description? Just not for me, but just to share it around. Okay, thanks.
Thanks.
Okay, anything else? Or maybe just send it to the board in case anybody knows we can help with distributing it, especially since some of us are at the colleges. Might have some students that are graduating that would be interested or have graduated. Okay. All right, everybody, have a great rest of the month, and we'll see everybody in July. Bye-bye.
Thanks, everybody.